Hello, everyone. Welcome to our panel discussion today. We really appreciate you taking the time to join us here. And I think we're going to make really good use of the next 45 minutes or so. My name is Michael Ames. I'm Senior Director for Healthcare and Life Sciences at SADA. And joining today on this panel are two men I've worked with quite a bit over the last few years, Steve Hess and Mark Eimer. I'm going to let them introduce themselves in a minute. As we were shaping up the content for this session and thinking through what would be valuable to the HealthIMPACT community, this idea of looking back on the last 18, 20 months and seeing what organizations seemed to do well through making good decisions and good choices in the pandemic, and looking at those retrospectively, what worked and what didn't, and how is that helping us prepare for the future may be useful. Whether that's a future pandemic, another crisis, we hope not, or even just a future that we're looking at right now with difficulties in staffing demand and other challenges. We brought together some really outstanding folks, and I'm excited for you to meet them if you don't already know them and to hear a little bit about what they've done. So Steve and Mark, I'd like you guys to take a minute now, introduce yourselves, tell us a little bit about your role and your background, and then we'll jump right in with questions. Let's start with Steve.
Steve Hess, CIO at UCL. It's in Colorado. It's 12 hospitals, 2,000 beds, 5.6 billion, about 4.1 million ambulatory visits. So we're on an enterprise instance of an Epic EHR across that footprint. I've been in healthcare IT for 30 years and a CIO for 17 of those years. Mark?
Thanks, Steve. Hi, my name is Mark Eimer. I'm the Associate CIO and Chief Technology Officer for Hackensack Meridian Health. We're a 17 hospital system, 500 locations, about 7 billion in revenue. And so I've been in this role for approximately 3 years with Hackensack Meridian Health.
We're also really happy to be joined today by Lisa Stump, CIO at Yale New Haven Health. Lisa, will you give us a brief intro on yourself?
Yes, thank you. I am Lisa Stump. I am the Senior Vice President and Chief Information and Digital Officer here at Yale New Haven Health System and the Yale School of Medicine. We are a 5-hospital health system here in the primarily Connecticut region, with practices and hospitals, though, covering New York, Connecticut, and Rhode Island. And really pleased to be with you all today.
Thanks, Lisa. So let's jump into our discussion here. What we want to start is thinking back to the frantic days 18, 20 months ago in the early period of the pandemic. We had sudden and unexpected challenges. In that moment, there were likely investments that you had already made in your organization that you found yourself grateful for. We'd like to hear about those. What were some of the things that you were thanking yourself, prior decisions, before we knew there was a pandemic on the way, that had a payoff in those early days? Think of it in terms of technology, but maybe it was also a surprise team or program that was in place and sort of emerged as an unexpected superstar during that period. Let's start with Mike, and then we'll go to Steve and Lisa. Sorry, with Mark, and then we'll go to Steve and Lisa.
So thanks, Mike. So I think for us, we had just started the Google journey. So for us, we had a program called Going Google, and we were working on rolling out Workspace, and we were going to roll out Chrome OS devices as well. We weren't there yet. We had just implemented Zoom for the board at the time, because they wanted some more virtual options. And then when the pandemic hit, we pivoted very quickly. Zoom became the platform across the network that we leveraged. The Chromebooks that we had purchased quickly converted into managed devices. We put them in basically kiosk mode. And literally sent workers home to use the Chromebooks. And we had a high reliance. We're already an Epic shop, so we already had a large Citrix deployment going on. we really just expanded the enterprise apps farm for Citrix to really support the work from home. I mean, March 15th, I still remember today, the CEO saying, I need everyone working from home. But yet the technologies that we had really didn't, and the strategies weren't around a mobile workforce at the time. So we had to pivot very quickly.
So you have the core of things in place to enable a remote workforce deployed in small ways. The pivot was like you already had the strategy in mind. The pivot wasn't to new technology, but it was to accelerate and expand that very quickly. Is that right?
Oh my goodness. Yeah. I mean, COVID was the great external transformational factor that literally pushed us into all sorts of areas that we were probably dipping our toe in. Weren't real sure if work from home was going to allow for productivity to maintain its levels. And, you know, when the CEO said, everyone go home, we literally had to pivot quickly. And, you know, we had the technologies, but we hadn't really fully worked through all the use cases or even developed how we were going to use it. And everything was done really on the fly.
Mm-hmm. Steve, what about UC Health?
Yeah, I think I have a similar story that Mark just shared. So I think, you know, one of the common themes here, I think, during the pandemic is those organizations that invested in their digital strategy and frankly intertwined their digital strategy with their overall organizational strategy were probably ready for this, and many times just scaled what they already had. So for example, we had been doing virtual health, virtual visits, virtual urgent care 24/7 since 2016. But our virtual urgent care visits, as an example, were 13 a day in January 2020. In February, they were 250 a day. We went from 1,000 virtual visits a month to 77,000 virtual visits overnight. But we actually didn't build anything. We scaled what we already had. So those forward-thinking advanced organizations like you have on the panel today had leveraged their digital strategy, had leveraged their enterprise EHR implementations, and then scaled it for what we all had to do during the pandemic. And as Mark said too, the COVID was a great accelerator. We had 600,000 portal users pre-pandemic. We have 1.6 million portal users now. So that it just became a burning platform for joining kind of this digital revolution. So again, I think that many of the advanced organizations pretty much had this capability, and this was actually an accelerator and still is. I don't think we've stopped accelerating.
I was following CT Lynn's posts and blog posts in those early days. You're a CMIO there at UC Health, and it was fascinating seeing him post up day after day telehealth visits going to 10x what they were the day before, 100x the day after, and just how, so that has expanded hugely, and you think that is continuing to span. I'm sure you've seen it taper off.
Yeah, so it's actually really interesting, Michael. So I think that we went from 1,000 to 77,000, and now we settled into about 26,000 virtual visits a month. So we certainly have not gone back down to 1,000, but we're not obviously at 77,000. But what's interesting is it's hard to paint a broad stroke. It's not virtual visits are dead again, or they're very much part of the future. 95% of our behavioral health visits are virtual. 95%. So that's a specialty that's tailor-made for this that will never go back, right? But obviously a surgical specialty, much harder to do a virtual visit for. So things like primary care are about 25%, neurology is 30%, behavioral health 95%. So it's not this broad stroke of everybody's doing it or nobody's doing it. It's kind of found its way now.
Yeah, it's exciting. Lisa, what were you patting yourself on the back for in those early days?
Yeah, I think similar to my colleagues this morning, certainly the prior investments in Citrix and our virtual private network VPN technology really allowed us essentially overnight to move tens of thousands of employees to the safety of remote work. And so that was, I think, an incredible advantage coming into the pandemic. Telehealth, similar to Steve's comments, I think we were worse off initially. We were doing about 1 visit a day, just about 5 per week prior to the pandemic. We peaked at about 5,000 visits per day. We've tapered off now at between 2,500 and 3,000 telehealth visits a day. But, I think really a great trajectory and the right conversations now underway around, what's the optimal place for tele and video care. Telehealth in the inpatient environment, we haven't touched on yet. It was an area where we were glad we had started to make investments there. And so really quickly, we're able to leverage. One of your points in the question was, were there teams that surprised us? Our clinical engineering and telehealth technology teams scaled very quickly. We were fortunate. We had recently opened a regional operations center, essentially a large warehouse that allowed us to acquire quickly lots of the mobile, video carts that we were able to build. I had team members out there with drills and equipment, assembling carts and equipment to be rapidly deployed to the inpatient rooms across our hospitals, which allowed us to leverage specialists in one hospital to help care for the growing number of COVID patients that were being seen across our organization. Being close to New York City, which was the epicenter, as folks know, our numbers grew quickly, particularly in our Greenwich Hospital area, and slowly moved up the shoreline here in Connecticut. And so that inpatient telehealth infrastructure was as important, honestly, as the outpatient infrastructure that we had in place. We haven't talked about call centers. One of the successes that we also saw, thankfully, we had recently upgraded to an enterprise level suite around our call center capabilities and technologies. Early on, we opened a COVID call center, right? The communities had lots of questions about COVID, about testing, about treatment options. And so we, over the course of a weekend, stood up a makeshift call center, quickly realized it was too small for the safety of the people working in the call center. Over another weekend, dismantled and rebuilt it in a bigger space. And then about 2 weeks later, sent all of those people home and operated that call center entirely remotely. But it was a huge, literal lifeline for our communities as we were, being called upon to provide information in a very scary and uncertain time. So,
Lisa, I'm thinking about a couple of years back, I think you were quoted in Becker's. They were asking CIOs about terms they hated, and one of the things you said was keeping the lights on. You don't want IT described as a keeping the lights on organization, because it kind of demotes everybody to just, we're just here for maintenance. And it's amazing to me how much the pandemic gave organizations like the three of you operate the opportunity to show just how far above and beyond that you can go. Now, I think it's been a while since anybody at UC Health, Hackensack, or Yale has accused IT of being a keeping the lights on organization. But there are lots of hospital systems out there where that's still the case, right? And where the function of the CIO's office and the IT department is still basic maintenance as opposed to a partner to get things done. It's thrilling. I never want to repeat this pandemic, but if one good thing came out of it in our industry, it's really putting to rest the question of the essential strategic nature of the IT departments that you guys run. So these are some great illustrations. Let's move forward then a little bit. So we've talked about the things you already had in play. It sounds like in all these cases, the technology was there, the services and the people were there. You discovered how much you could accomplish in a weekend if you had to, in scaling these things out and going big. Let's talk now about what was new. Let's shift up the order a little bit. I want to go to Steve, Lisa, and then Mark. New investments that you made post-pandemic that you feel like was the best use of your time, energy, and money, and had the biggest payoff. Go ahead, Steve.
Yeah, so I think that one of the things that we had in place prior to the pandemic, scaled during the pandemic, and now actually are invested in more, is really around our virtual health center. So we actually have a offsite virtual health center staffed by technicians, RNs, APPs, and MDs. It's 24/7. They're actually the group that also delivered the virtual urgent care, but they're doing things like, traditional centralized telemetry. They're doing fall sitters, so virtual fall sitters, but they're also doing virtual ICU, virtual, med surge surveillance, and we implemented like virtual sepsis surveillance. So they're watching over the sepsis clock and sepsis deterioration interventions across our 12 hospitals. But with the pandemic, we also scaled them to be doing more outside the walls of the hospital. So we actually have remote patient monitoring programs now that are focusing on positive COVID patients in the inpatient who are stable, but we can actually discharge them, watch over them for 8 days. It's almost like kind of the foreshadowing of hospital home. So the whole, RPM, early discharge surveillance, and true CMS hospital home, those are things that, our strategies pre-pandemic, and the need for something like this to decant our hospitals and keep patients safe at home is only, again, accelerated based upon what we're doing. So those kinds of investments, I think so virtual health and taking care of patients outside the walls. I think the other big, really good thing, if anything is good out of the pandemic, was the organizational embracing of really good predictive and prescriptive intelligence. So again, pre-pandemic, lots of good analytics with Epic, with Microsoft, with Google, and so on. But the reality is that because of the need for real-time data, like as in, I need this data for ventilators and inpatients and positivity scores and predicting surges and so on, that need for that analytics and more of that machine learning, AI, predictive prescriptive intelligence, that's accelerated our adoption of that dramatically. And so that's another never go back. We've created some non-IT operational intelligence teams that then partner with the IT teams and external data scientists to do some really crazy good things that have just allowed us to make dramatically better decisions. So that investment in both virtual health and in our intelligence infrastructure have paid off time and time again.
That's outstanding. I've been to and toured your virtual care facility, the remote patient monitoring facility, and I just got to tell folks who are listening, the Starship Enterprise has nothing on that office space down there. The amount of technology and the cool blinky readouts, not to mention smart people sitting in those seats. If you're looking for a model of how to do that, take a look at what UC Health has done there. It's remarkable. Now I've lost track of who I said was next. Was it going to be Mark?
I think it was going to be me,
Lisa.
but yeah,
Okay,
that's okay.
Go ahead, Lisa. Go
It
ahead.
can go either way.
Yeah, go ahead, Lisa.
Lisa, take it away.
Sure. In terms of new investments, I was struggling a bit. I do think for the most part, our response during the pandemic was to dramatically scale what were existing investments. In some cases, those initial investments were small, and so the magnitude of our scaling was much larger. But the themes are right in line with what Steve has shared. I'm feeling a bit remiss in not mentioning data in the first answer. Our ability to move to that real-time data, I think, has truly revolutionized the way that meetings are conducted and decisions are made here in the organization, business decisions and clinical decisions. And, I recall being part of one of our larger meeting forums just a couple of weeks ago, and my colleague who was leading the conversation and discussion quickly through Zoom, shared his screen and launched the live dashboard. And I thought, we've arrived. It wasn't yesterday's or last month's data in a arts and crafts rendition on a PowerPoint slide. It truly was looking at what was going on in our organization in that moment. And, I do think we will never turn back. Some of the new investments, truly new, we tried to push the use of bot technologies. I mentioned that call center earlier. It was quickly overwhelmed with call volume, basically 24/7. And so we did introduce bot technologies to help start to answer some of the very frequently asked questions that were coming in, that allowed our people to spend more time on the harder questions, and the people who needed that high touch approach, and use technology to manage what were some of the easier answers. I would say, again, double down our investments. Again, I'd be remiss in not mentioning the power of having a single Epic instance across all of our care settings, the ability to leverage it for scheduling once we got to that phase of being blessed, frankly, with a vaccine, and we needed to get people vaccinated quickly, to schedule testing. That common platform allowed us to operate in ways we never could have imagined, with testing tents and mass vaccination centers all around our state.
There's a theme here that I'm interjecting here before Mark comes in to see if I'm predicting the theme correctly, which is really that I think as we devised this topic, we were envisioning more about what did the pandemic trigger you to do that was new. Really what we're hearing is that the things that mattered, the best investments that you made were the expansions of things that you already had in place, which speaks strongly to the need for preparedness, to looking forward, to making sure that you have things. And it's not that, it wouldn't have made sense to move half the workforce home and work remotely prior to the pandemic, but you had the technology there. You had integrated EMR instances, right? You had Citrix, you had the other things that you needed there, so that when the crisis came, you could expand. A different kind of crisis might have resulted in expanding different technologies, but in the moment of crisis, it's probably not when you're going to go shopping for something new, as much as build upon what you already have. So now I've said that, Mark, you're either going to prove me right or wrong.
Well, I think you're probably pretty spot on, Mike. I mean, while the pandemic definitely allowed for a lot of innovation, and it took bureaucracy out of decision making because it was more around just to get it done. You didn't have to go ask for permission anymore. You're more along the lines of asking for forgiveness, of just rolling it out and getting it done. But for us, we had the same call center issue that Lisa and Steve had, right? We had to quickly procure a web-based solution contact center. We had about 80 call centers that we had to get working from home. We had a patient access center that we literally stood up overnight to take patient calls coming in. We were asked by the governor to set up a mega vaccine site that, out in the middle of the Meadowlands, and get that up and running. And well, how do you do it, right? I mean, these are things, to Lisa's point, we started to install all these 4G routers, new technology that, we hadn't really tested, internally, but we throw out a whole bunch of new technology, with wow carts in the sorts, just so we could do, in excess of 750,000 of vaccines at the Meadowlands. I mean, it was, and then to say, I need you to go out into the community and we're going to go vaccinate in the community and we're going to go to the train station. Okay, we've never set up, a vaccine site at a train station before. So there was a lot of MacGyvering going on during the pandemic and leveraging a lot of the core and basic. So our standard WOW card had Chromebooks on it running Epic, back to our 4G router, back to the homeland. I mean, it was, we were MacGyvering as we were going, pulling from the toolkit that we had built to build these solutions that weren't sure it was going to work or not work, but we sort of pulled it together and it all worked, right? We did do the chatbot solutions to try to minimize the amount of call volume, right, coming in, from everyone, and and worried that when people were going to register for vaccines, it was going to crash Epic, right? We were building out so much capacity to ensure that when the public was scheduling, for vaccines, that, we didn't go down like so many other sites did. So there was a lot of scurrying around and a lot of praying and a lot of hoping and a lot of MacGyvering going on. But at the end of the day, we did leverage a lot of the core technology that we had previously invested in.
Yeah, I think that, okay, so that's an important qualification is the core technologies expanded, but that doesn't mean that you had to figure out how to do a bunch of stuff that you'd never done before in crisis mode, nights and weekends. And I guess there I would say what you were expanding on was the innovative capabilities of your workforce, right? You had good people in place who were able to think big and willing to commit the time and effort and energy to go make those things happen. Steve, you were smiling and nodding at a couple points there, and I know UC Health has played a big role in the vaccine rollout and things here in Colorado. Is there anything you want to add to that sort of MacGyvering vaccines into the community?
Yeah. So as Mark was talking, I was smiling because I think all three of us, our organizations, probably played a public health role in our state that we never assumed we'd have to play. And so, we were all collectively fighting this invisible war. And it was incredible to see our doctors and nurses putting their lives on the line, frankly, every day. But our IT teams were able to kind of come together and actually create this huge community outreach, community benefit, almost a public health service. And the largest health systems in each state probably played that role. So I think that's something that not everybody probably understood, that, we didn't have a national response. Frankly, we didn't even have state responses. Usually the largest health system in the state ended up playing kind of this public health role. I think the other thing too, again, to just amplify a little bit what Mark was talking about, the creativity and innovation and work ethic of our teams just cannot be overstated. Like, I'm just so proud of how UC Health responded, just like Mark and Lisa, I'm sure, are proud of their own organizations, but I'm very, very proud of how the IT team stepped up as well. One of the funny / creative stories we have here. So we implemented Healthy Planet, which is the Epic Pop Health tool, 2017, 2018, right? And we use it for risk scoring cohorts. You can actually put diabetic patients or congestive heart patients or patients of risk of readmission in these cohorts. And then your value-based contracts can be modeled after those, and care management and virtual health and so on. Well, we used that Healthy Planet registry architecture to actually schedule and invite our patients to get vaccinated. So early up, so try to rewind back to like the middle of December 2020, we had a lot of people who wanted vaccinations and not as much vaccine. Pfizer was just starting to roll out. Moderna was probably 2 weeks away. So we had, hundreds of thousands of people who wanted the vaccine and 20,000 vaccine doses. So we actually used Healthy Planet, those registries, to put the different phases of the patients in those registries. And then we used online scheduling, our mobile app, our web app, to invite those patients in those cohorts to schedule and then get vaccinated, their first dose and their second dose scheduled in a panel schedule. So that's a great example where we used this Healthy Planet tool to manage population health. And my team, my creative team, said, you know what, we can use it for vaccine lotteries as well. And we actually were able to deliver vaccines like day one of when the availability was through this invite online scheduling approach that worked out extremely well. Ask me 2 years ago if we would have had to create a vaccine lottery, I would have said, what are you guys talking about? And the team used a tool in a way that it wasn't meant to be and delivered for the state of Colorado and beyond. That's what these good organizations, these great organizations that you have on the panel do. And it's, a lot of smoke and mirrors and magic going on behind the scenes, but the outcome was a response to this war that was extremely positive.
Yeah, I mean, such great examples of layering the creativity and the talent of people on top of having made the right, well thought out technology investments and how that can help you be prepared for the unexpected things that may come. If you had said vaccine lottery 2 years ago, I don't even think we could have imagined what it meant, let alone how you would implement it, right? Yeah. So, and that's actually a good segue into what I think is kind of the final chapter in the discussion here, which is around, I'd like to get your thoughts on building resilience toward the next crisis. And the trick here is we don't know what that's going to be, right? So as you think about it, and in a couple of perspectives, in terms of technology, what are the new core technology investments that you're thinking of making or areas that you're going to continue to expand? And also in terms of talent, we have a problem right now that's hopefully a little bit temporary, but today there's another little emerging crisis, which is the difficulty in acquiring and retaining talent across the industry, both on the clinical side and on the technical side. So given how much we've focused in this discussion today on how important the people were, what are you doing to try to make sure that you've got people to be prepared for the next thing? So it's fairly broad, but just think about how are we getting ready for what's next? And let's do it this way. Let's go Lisa first, and then Steve, and we'll let Mark have the final word on this one.
Yeah, I think I got the hardest one to go first.
I
think, our people certainly are, I think, the greatest asset that we have, and the pandemic certainly, underscored that. Our approach is, I think, probably to some degree fairly common, again, against other high caliber organizations. But, organizationally, we have been committed to really measuring the level of engagement amongst our employees. And we do that at least annually through a very formal employee engagement survey. In our ITS division, I have then chartered a employee self-governance structure and group to help me and my leadership team understand what those survey results are telling us, and how we then put into effect things that matter and are meaningful to our teams. And we all know pay is important, but pay is not the only reason that people get up out of bed every day. And I was going to say come into work, but log in to work. Recognizing that there is that now national, essentially, competition, right? We have unfortunately lost a few team members who can continue to live here in the community that they love, but work for other high caliber organizations now across the country. And so the importance of telework, also became very clear early on. I had the opportunity to co-lead with our Chief Human Resources Officer, a broad scale look at our telework approach. What did our policies say? What did our job descriptions say? How were we ensuring that we could be as flexible as we were going to need to be to attract and retain top talent? But we've also looked at our pay. We looked at market analyses to ensure that that caliber was where it needed to be, and then very much look to partner where appropriate with some managed services organizations to augment the staff and talent that we have. I think that's the people side of the equation, Mike. I think that there is also the question of what are the skills that are going to be important as we go forward, and some of that flexibility in the workforce through some of the staff augmentation firms, I do think helps us maintain some ability to be nimble in acquiring some of the very perhaps specific and newer talents that we need, while we continue to invest in the training of the workforce that we've got.
Lisa, that's great. I appreciate that. And Steve, what about you? Technology, people, how are you getting ready for what's next?
Yeah, so I think let's talk about people. So I think Lisa mentioned quite a few things that we're probably all doing, but I look at it as a toolbox. You got a bunch of tools in the toolbox. Compensation's one, remote working's one, but the toolbox label says flexibility and choice, and that's the reality of it. This is all about flexibility and choice, and we all have team members who can go work for anybody. They don't have to move, and then they can work for another organization for insert here double-digit % increase in compensation, right? But we have to have a strategy around benefits, comp, pay time off, other things around flexibility and choice. And I think one of the tools in the toolbox is your digital capability, your innovation, the projects you get to work on. There's something about people that work in healthcare IT. They're mission based. They can make a lot more money at Google, at Amazon, at Microsoft, and so on. But there's something special about being here. So working on projects where they're impacting people's lives, there's something about that. So a tool in the toolbox is around innovation and creativity as well. I think there's two other things that we're laser focused on, and we need to be better at it. One is making sure that everybody's working at the top of their scope. And that's true for a doctor, that's true for an RN, that's true for a technician out in the bedside areas. That's also true for IT. And making sure that people are really working at the top of their scope and that we're reducing administrative burden wherever we possibly can. Let's make things more frictionless, okay? I think the other thing too, and this is a really tough topic, but we spent a lot of time, money, thoughtfulness around mental health capability and behavioral health capability for our staff and creating capabilities for them to seek help and in a safe and protective way. So, we went from a pandemic crisis to a staffing crisis. I'm afraid we're going to land in a behavioral health crisis as well. And so we really need to create some resilience around that mental health and behavioral health, and no one's immune from that. So those are some of the interventions we're doing. They're hard. There's no silver bullet. It's a journey. It's not a sprint here, but we are kind of looking at this from that multiple lens perspective.
For a lot of organizations, I think the kinds of things you're talking about are things that the organizational leaders may have wanted to do for a long time. But when you believe that IT is a keep the lights on organization, it's hard to go make those arguments. This is the time now for folks who are listening in on this to take some of the insights here around how important the people were for helping to respond to the crisis, and to say we've got to figure out how to do more for the people. Because if we're just barely keeping them here because they don't have other options, if we think we're going to keep them here because they don't have other options, we're going to lose them. And we've got to look at how we take care of the whole person. Like, now is the time to tie directly those investments that the people who hold the dollars for you need to make to your organization's ability to be ready for the next problem that hits the roads. These are some great insights, Steve, Lisa. Thank you. Mark, take us out. What are your thoughts here?
Yeah, I mean, I don't think mine are going to be drastically different, than Steve and Lisa. I think for us, clearly, the previous methodologies of building everything inside the four walls, presuming everyone's coming to work, and they're doing their job, that's all gone out the door, right? So flexibility, I now have the ability to tap into all 50 states, to find the right talent, anytime, anywhere, any device, is really our strategy and methodology moving forward. Whether it be from a clinician doing telehealth from home, whether it be a radiologist doing reads from home, whether it be, a back office corporate type function that needs to work from home or work anywhere. So, so we're trying to put flexibility into everything. I think the behavioral health piece that Steve brought up is critical as well. We did hire a chief wellness officer in the middle of the pandemic. And we do have, 2 years ago, we purchased Carrier Clinic, the largest behavioral health facility in New Jersey, 300 beds. And so, behavioral health has now been a huge piece. But I think at the end of the day, everyone talks about leadership, in sort of everything. And Mike, you sort of nailed it on the head. I'm focusing on Manager 101, right? Because you need to be able to manage the resources, and especially if they're remote, right? How do you know they're having a bad day? And how are you really focusing and getting them and understanding what their needs are, right? And how do you get them to collaborate with the rest of the team? So we're also focusing on sort of that Manager 101 skill set. on not just how do you manage people in the office, but how do you manage that hybrid workforce, both at home and in the office? And do you have all the tools that you need to help them be successful? Because not everyone works well in a home, a home office environment. Whether you've got kids, you got dogs, you're, dealing with dependent care, whatever the issues are. And so it's really tailoring what we need to do for individuals. But right now at HMH, IT services here, we're at a 50-50 hybrid model. I have people out of state, I have people in state. If you're out of state, I'm still expecting 25% travel, so we can still have that touch point and collaboration piece. But we're 50-50, and I think it's finding that happy medium. We subscribe to great places to work, and like Lisa, we do engagement surveys and want to understand what people want. And I think it's that balance between how do you make the people happy and make them and give them the tools that they need to be productive, and at the same time meet the business need. And we're in healthcare, right? So there's some roles that can work from home, and there's some roles that can't, right? And so, it's just understanding that balance and really working with them to make sure that we can meet all of that. So it's definitely a challenge, but I'm definitely happy that we've expanded, the geography of where I can go look for help on a more permanent basis. So it's definitely been a pleasure trying to come up with the hybrid work model.
Mark, thank you, and thanks to all three of you. I got to say, when we stacked up the attendee or the participants on this panel, I thought we're going to get some great stuff out of this. You did not disappoint. I love it when we're planning a particular topic and it takes another angle, which is where the real insights were. We expected this conversation to be more about technology and applications. The conversation ended up being more about people. And that is the answer to the question, right? What were the best investments that you made? What are the investments that you're making now to go forward to be prepared for the next thing? That technology is important, the people equally or more so. If we take nothing else out of this, I think that's crucial. Lots of great other specific insights from each of you. For me as a healthcare consumer and merely a consultant to the healthcare provider community, thank you for the work that you did and your teams did getting us this far. And I know we're not out of the woods yet. So thank you also for the work that you are continuing to do and for the insights that you shared here with your community today. Thanks to everyone who attended and listened in on this conversation. I know that HealthIMPACT is providing a mechanism for questions and answers. And so please participate there, and we'll try to get your questions answered and hope to see you again soon. Thanks, everyone.